Hey there, health warriors. Caring for someone at the end of life is one of the most sacred responsibilities we take on as healthcare professionals and caregivers. Today, we're talking about end-of-life and palliative care, how to support patients and their families with comfort, dignity, and compassion during one of life's most vulnerable transitions. Let's take a closer look. Palliative care is specialized medical care focused on relief from pain, symptoms, and emotional stress for patients with serious illnesses. It's appropriate at any stage, and can be given alongside curative treatments. End-of-life care, on the other hand, supports patients who are likely in the last months, weeks, or days of life, with the focus shifting fully to comfort, dignity, and quality of life. These approaches are not about giving up. They're about honoring the person's wishes and needs as life comes to a natural close. Needs of patients and families. At this stage, patients and families often need comfort, physical, emotional, and spiritual relief. Clarity, honest but gentle conversations about what to expect, support, reassurance that they're not alone. Respect for their decisions, values, culture, and pace. The goal is not to fix anymore, it's to be present and provide peace. Role of healthcare workers and caregivers. Manage symptoms, not just illness. Prioritize comfort. Address pain, breathlessness, agitation, and nausea. Use pain scales and adjust medications as ordered. Keep the environment calm and soothing. Communicate with kindness and honesty. Speak in clear, compassionate language. Don't avoid the word dying if appropriate. Truth allows people to prepare. Listen more than you talk. Let them express fears, regrets, or hopes. Support the family too. Educate loved ones on what to expect. Encourage self-care and offer emotional support. Be a steady, non-judgmental presence. They're grieving even before the loss. Preserve dignity in small acts. Respect modesty during care. Involve the patient in decisions when possible. Call them by name. Treat them like the person they are, not just a patient. Signs of approaching end of life. You may notice changes in breathing, like Cheney-Stokes. There might be a weak pulse and cold extremities. Decreased appetite and urine output are common. Increased sleep or withdrawal, and periods of confusion or spiritual conversation can also occur. These are natural signs. Our job is to comfort, not cure. Caring for someone at the end of life is hard, but it's also deeply meaningful. As healthcare workers and caregivers, we're not just here to help people live longer, we're here to help them live, and die, with dignity. Have you supported someone through end-of-life care? Share your reflections or what helped the most in the comments. Like this video? Give it a thumbs up. Subscribe for more caregiver education, compassionate care training, and real talk from the front lines of healthcare.